Allied Health Week. We are so excited to be here today and for the week. We have all kinds of wonderful presenters lined up. My name is Deneen Diamond. I'm the lead for the Center of Excellence for Health, and we are celebrating everything allied health for this week and for the month, actually. And I see that we have some folks from Miramichi Valley High School in the Career Pathway Design course. If you guys want to put your camera on and give a wave, that would be lovely. Let me see you. Oh, awesome. Thank you. So excited. We are really excited to have our guest speaker here today. Her name is Jackie Parks, and she is here and going to be sharing her role at her job, and she works at a Shannex here in the province. So we're really excited to have Jackie. She's going to be looking at what happens at long-term care and what she does as a registered nurse and community manager. So without further ado, I'm going to hand it over to Jackie. And this is Jackie's second time being involved in Allied Health Week. She was involved last year as well. So Jackie, thank you so much for joining us, and I'm handing it over to you.
Perfect. Thanks for having me. My name's Jackie Parks. I actually grew up in Miramichi, so yay, Polemo, woohoo! Class of 2006 here. So it's exciting to see some Miramichi folks here. So yeah, if you want to start my slideshow there. Perfect. About me. There's a nice picture of me. So, I grew up in Miramichi. When I was young, I always thought I'd be a math teacher or a nurse. I wasn't sure. My sister's a registered nurse, so she kind of led me in the way of being maybe a nurse. She kind of talked me into it. So she kind of helped me out all throughout my career in my nursing school and my nursing studies, helped me with, all my essays and all the things. If you want to go to the next slide. There we go. Yeah. So, growing up in Miramichi, I played a lot of volleyball, a lot of basketball, did all the sports, all that kind of thing. Spent a lot of time with my family. Things I like to do outside of work. Obviously, I love podcasts and reality TV. I got 2 kids, like you can see in the middle picture there. So my 2 kiddos and my dog and my husband, they're probably my greatest achievement in life besides my job. Some of skills that I think I have that are really important for nursing is I'm very outgoing, I'm very organized, and I like to call myself the multitasking wizard. I can probably do about 10 tasks at once. And then my motto for my life, every year I kind of give myself a motto. This year it's just say yes. So say yes to everything, hence why I'm here again this year. Say yes. And be positive, always look at the positive, try and stay away from the negative is a big thing. There's a little picture of the Miramichi River there on my screen, as you guys can see. That's in Upper Derby. I don't know if anyone's from up that way, but we have land up there. So that's Miramichi, that's home. So yeah, that's a little bit about my background. So I started in nursing at UNB in Fredericton in 2000 and I'm trying to think 7. I would have started 2007. I took a kind of year off in between school and high school and my university degree. So yeah, did 4 years there, and we'll kind of jump into what that education looks like after this slide. But I started as a staff nurse in a small rural hospital in Ontario, and I worked there for about 10 years, first in med surg, and then I went down to emergency nursing. I was there for most of my career. Like I said, we were in Ontario. We moved out right out of university. And when it was time to come back home, I didn't know if I wanted to do critical care anymore. So I kind of jumped ship, went to long-term care, started as staff nurse at Shannex, and then slowly kind of quickly worked my way up to community manager there. So I've been with Shannex in long-term care for over 2 years, and in my role for just over a year and a half. Some positives and negatives about nursing in the geriatric population. The population itself, they're the most loving people you would ever meet. Putting a smile on their grumpy faces is sometimes the best part of my day. And just being an advocate for those people. There is what's called sexism, or no, sorry, not sexism, ageism. And I'm a big believer on everyone deserves a chance. And so I'm a big advocate for that and making sure that my residents get the best care and get all the options for those cares. So the most rewarding part, yeah, is just getting to know our residents, providing the best end of life care for them because they do come to nursing home usually for their end of their life. And then the worst part is just saying goodbye to them. So, when they do pass away, you usually have a big connection with most of these people. So it's that's the worst part about the job for sure. But I mean, it's the progress of life and it is what it is. Some skills for community manager or nurse, just in general, you do have to be organized, a multitasker. We're sometimes doing 2 or 3 things at one time. So it's a good skill to have. And making sure that the residents receive the best care is obviously my core responsibility in my role. So just, overseeing all that. I'm self-directed in my role as community manager. So, I do take charge of my day and make my plans, but I also work really closely with the team, jump in where is needed. And looking back, opportunities are endless. I could have opened the scope of practice earlier to try new things, but you get into your rut, and you get into what's comfort. And I'm really happy that I did take a new opportunity with long-term care a couple of years ago. I just fell in love with the geriatric population itself. And then career paths, nursing. I mean, nursing in general, there's millions and millions of different career paths. You can usually start out as a floor nurse, wherever that may be, whether it's long-term care or on the nursing units. And then the more education you have, the more opportunities you have. So I always say, like, say yes to everything. And we'll talk about that a little bit later. Be prepared for shift work at first. Sometimes you don't normally just slide into a Monday to Friday job. So there are night shifts, evening shifts, weekends, lots of weekends. So that's a big thing to kind of prepare yourself when thinking about nursing. Is that something that I could do? Because you do make some sacrifices for your patients and your residents because, you work the Christmases, you work the New Year's, you work the holidays, the weekends and stuff like that. So it is a big sacrifice being a nurse. And then work placements are always available, and nursing is the most rewarding job. Sorry. It's the best feeling when you help someone accomplish something, whether it's just something small to something huge, right? So yeah, if you want to move on to the next slide. So regarding the education that you need for to be a nurse, and then we can talk about my role. Usually it's a Bachelor of Science in Nursing. Now that's for a registered nurse. There's other types of nurses. We at long-term care have LPNs, so licensed practical nurse, and we have PSWs. So the registered nurse is a 4-year program at a university level. LPN is at the community college level. It's about 2 years. And then the PSW course, I believe, is 6 to 8 months. And that's community college as well. So just, it's kind of the stepping stone. I always say to people, if you're unsure, you could always start with PSW. There's bridging programs, and you could bridge into LPN, and then you can bridge into RN. So it just kind of breaks it up. Or maybe you start as a PSW. And I mean, I believe my PSWs are nurses just as much as I am. Their scope of practice is just a little bit different. So yeah, you can always start there and move your way up. So yeah, I did 4 years at UMB. After that, I started working on the floor and where I did my preceptorship. So at the end of your nursing degree, you do, I think it's a 2-month placement wherever you wish to go, which is a great opportunity to really see something that you're really, really passionate about. And then usually after that, you can get a job there. So that's what I did. I did my placement on a medical surgical unit in the community that I was going to be living in and ended up getting a job there. I worked in that same facility for 10 years before moving back here. And then now I'm at Shannex. Through Shannex, and probably most nursing companies, like big companies, at the deck, the hospital and stuff like that, Horizon Health, they have lots of learning opportunities and development. So I always jumped for that. I have different courses underneath me. I have my skin management course. I have my palliative leave course. I have my basic life support course. I had the opportunity to become a GPA certified trainer through Shannex. So now I teach GPA, which is gentle persuasion approach. So just teaching my staff how to be gentle with those suffering from, Alzheimer's, dementia, stroke, stuff like that. And then I previously had my ACLS, which is a acute critical care course, and my PAL, so pediatric life support. Those have since expired because I'm not using them in long-term care, but there's tons of opportunities. There's tons of education out there. Once you become a nurse, it's not really the end all. You have to keep educating yourself and keeping up with that. The only thing that is required for me to work at long-term care currently is just like our Shannex modules that are due yearly. That's on hand hygiene, the WMIS, all those kind of things, as well as CPR training that we have to have updated every year. But again, there's lots of opportunities to learn and grow within companies. So yeah, next slide, please. Work experience. So now I'll go into kind of like what my job is as community manager. Um, so I always say like my day-to-day tasks change daily. I never have the same day, which is kind of nice. I usually make a list and that list sometimes gets done, sometimes it doesn't. So I'm self-directed. So I literally will do everything that's needed in that day, but then I also go above and beyond and I work really closely with the residents. I work really closely with the families. We do care conferences yearly with the families and the residents. So, just making sure that the care that's provided is what they want and what their wishes are. Our big thing with Shannex with a lot of long-term care is that this is their home. So we want to make sure that they're comfortable in their home and they receive the best care in their home and their wishes. So if they don't want to get out of bed at 8 o'clock every morning for breakfast, they can sleep in. That's totally fine. So that's kind of what we do. We get together and make sure yearly or as needed, make sure that everything is in place for those residents to have the best care. On top of that, I do lots of different paperwork and stuff. I do lots of auditing. I do a lot of education with my staff. Like I mentioned, I do GPA training. We do palliative care training. If we see something that's lacking, we'll do extra education with the staff. All disciplines too, from our PSWs right to our RNs. Nursing is always an ongoing learning. So we always have opportunities for learning. What else do I do? I help with like I said, I help with the floor. So if it's really busy, I can jump on the floor and do blood work or vitals. I can do incident management and reports. We do risk management weekly, which we meet as a team. The interdisciplinary team meets and we go over every resident. We identify any risks, whether that's dietary, whether that's wound care, whether that's falling, and we make a plan and we implement those plans so that the best care again is provided for these residents. Yeah, so I do a little bit of everything. It's kind of a nice job because it is busy. My days go by super fast. But when you make those residents smile at the end of the day, it's probably the best feeling in the world. Yeah, and then moving on. Lastly, so my big career advice for you guys, and I mean, some of you probably aren't interested in nursing, and that's okay, but if you are, and in life in general, I always say yes. So that's my new oh my gosh, motto for life is just say yes. So if a new thing comes up, a new adventure awaits, you get invited to do something fun, do it. Say yes. I mean, unless it's, as long as it's good for you. Try new things, try new adventures, and new opportunities arrive at work, even if you're working at a part-time job or, you're working at wherever. If they ask for education, say yes. If nursing is the path for you, and you're looking that way, make sure to ask questions. I always say give yourself grace. Nursing it's a hard 4 years. It's not easy, but once you're done, it's worth it. And be open, like I said, to new opportunities. So, look for those opportunities. Don't just kind of go through it. Ask questions. I always say, always just keep digging and keep looking for new things. Find your passion. Nursing, people think, oh, nursing, you just work at the hospital. There's so many fields of nursing that's out there. We have, you can do injections, cosmetic injections. You can do cruise ships. You can work as a travel nurse and travel all over the world. You can work in long-term care. You can work at the hospital. You can specialize in diabetes training. You can there's so many jobs out there. I probably can't even name all of them. So if you're unsure, nursing's always a way to go. You come out of a 4-year degree and you have a certificate and diploma and you can start your job right away. And yeah, if anyone has any questions for me, You can pop them out now if Miramichi has any questions. If not, I put my email address on there. And I'm quick to respond, so send me an email. Any kind of questions, there's never a wrong question. I always say to my staff, as long as you keep asking questions, then we're never gonna have any issues, because the more we talk, the more we can plan. So yeah,
That's awesome, Jackie. Thank you so much. I
you're
really
welcome.
enjoyed your presentation and learning more about your busy world. And
Yeah.
certainly it sounds like your days go by very, very quickly. I
Mhm.
think it's so timely and so wonderful that we have the Miramichi students here because you're
Yeah.
from Miramichi.
Yeah.
And I will say that nursing is something that's close to my heart. My mother is a nurse. My sister is a nurse. My brother's in medical school, and my sister's husband is a nurse as well. So
Perfect.
nursing is something that certainly I know a lot about, but you just taught me a lot about the long-term care kind of field for nursing. So I do see the camera still on for the Miramichi Valley High School students, and I'm just wondering if the students have any questions for Jackie. Um, and if you do, or if you don't want to come to the camera, you can just put in the chat if you have any questions, anything specifically about nursing. It sounds like Jackie has done a number of careers involved in nursing. And what's so lovely about these sessions is that we're really trying to showcase folks that didn't take that clear cut path. Because sometimes, especially when we're in high school and middle school, we think that we need to have everything figured out and we need to know what we want to do. Well, I'm here to tell you that I'm almost 50 and I still don't know what I want to do when I grow up. And I've done all kinds of different careers. And I think Jackie was a great example of how, you may have a set plan, you may have an idea, but really going for your passion and what you enjoy is
Mhm.
what's really important. And working with your residents and with your seniors, Jackie, sounds like that's probably the most important
Yeah.
part of your job.
Yeah. I love it.
Awesome.
They're so special because they're like my grandparents, right? Like, I always say that to staff, like, working with these guys, it's like working with my grandparents again. You know what I mean? Like, just
Yep,
making sure that they receive the best care, because I mean, even if they're old, they still deserve to have the best care out there. So, yeah,
I
I love it.
agree.
Yeah.
I agree. Any questions? Hi.
Hi.
Hi, I'm the teacher hiding in the corner.
Yes. How are you?
Yeah, so I think I maybe know your sister.
Melanie or Marley?
Oh, no, maybe not then. I was wondering if it was, I was thinking of a different name, but no, I graduated in 1994, so a little bit ahead of you. And there were some Parks people graduating at that time as well. And I thought one of them was a nurse, but maybe not. I was just wondering the impact on your career as far as the nursing shortage goes. I don't know if you discussed that already. I was kind of in and out of the room at the beginning of the presentation, but with a previous career pathway design class where it used to be called personal development and career planning, we did a project on the nursing shortage. It was a real world labor market information problem project. So the students were trying to find a solution to that problem. So I'm just curious, just because I learned so much through that process by doing that project with my students. I was just wondering what the impact is on you personally, I guess, or what do you see in your environment from day to day due to this current problem we have in our province and across the country and globally, I think.
Yeah. So when we moved back in 2021. So I seen the kind of the shortage starting before that. When I was working critical care at a small emergency room, like, it just seemed to be like overwhelming, right? Like, you don't have enough staff, the acuity's getting bigger. Before that, I remember before when I was in nursing school, my sister was a nurse in the Miramichi Hospital, and she's saying they're cutting all these nurses positions. They were cutting these positions, and we're like, what? We need these nurses. Like, don't they know what's coming? So in long-term care though, we were short quite a bit. I guess when I first started. So you're working longer hours. For me as community manager, I was jumping in more, so I wasn't able to kind of take on my regular task. I was on the floor, passing meds, doing that kind of a thing. I don't think I From my facility where I was at, there wasn't a huge impact. But there's always turnover too. But I definitely seen my friends struggle with it. just being short all the time, you know, unsafe practices, that kind of a thing. I think we're getting better, and I think that there's definitely work that still needs to be done. But I think we're moving in the right direction, I hope. Does that answer your question?
Yes, and I'm curious what kind of advice you might have for a new nurse, you know, who's coming into it
Yeah.
in this
Yeah.
kind of a situation. So,
Yeah.
I guess any advice for a young nurse coming out there, or not necessarily young, but new, who's just finished the program?
Absolutely. So it's funny because when I graduated, you couldn't get a part-time or full-time job ever. You had to work casual and work your way up. That's just what it was. Right now, you're graduating 4 years of experience, and then you get a full-time job wherever you want. So my biggest advice is just give yourself grace. I always say that. Ask lots of questions, and if they offer more education, take it. Um, they're investing in you, so always say yes. I think that leads to bigger and better opportunities as well. But always give yourself grace, and self-care is a big thing. So don't overwork yourself. It's okay to say no if they're asking too much of you, kind of thing. But yeah, always take care of yourself first, because if you get burned out too quick, then we need nurses, and we need nurses that are going to be in this field for a long time. So yeah, that would be my advice.
Awesome.
Thank you very much.
Thank you.
Thank you. And if the students don't have any other questions, I'm not sure if they have any questions for Jackie, but she certainly is a wealth of knowledge. And I just want to kind of repeat what you just said, Jackie. This morning we did a session on social work and social workers and how important it is to self-care. And I think all of us are probably learning that it's extremely important for everyone to make sure that they are putting those self-care practices into their everyday. And certainly in the allied health professionals, teachers, students, everybody needs to make sure that we're taking time to do something that we enjoy, for sure.
Makes a big
And
difference.
it could look different for everybody. Right?
Yeah.
Awesome. Okay. Well, thank you so much. Thank you, Miramichi Valley High School Career Pathway Design students. You guys are rock stars. Hopefully we get to see you again this week. We have all kinds of fun sessions planned for the week. And Jackie, thank you so much.
You're
what
welcome.
a lovely presentations. I see some kids waving. If you want to wave, that would be lovely. Jackie, thank you so much for taking time out of your busy day. And please tell the residents we said thank you for lending us you for the half hour. And everybody remember that the sessions are happening all week and they will be recorded. And make sure you take time for you today and get outside and enjoy that rain. Have a great day.
Bye.